name is Simone, and I'm talking about head extension. So, head extension is a postural compensatory strategy for managing dysphagia in the oral phase. It can be used for patients that have a history of head and neck cancer that have resulted in oral dysphagia. Head extension aids in the success of the oral phase of the swallowing by facilitating proper bolus transit to the posterior portion of the mouth. This strategy is frequently used by individuals who have had a glossectomy. So to demonstrate, Allie, do you have some water? Perfect.
Yes, I do.
Okay, we're gonna take a sip. Well, first I'll go over it and then we'll do it together. So first you're gonna take a sip of water, then you're gonna extend your head upwards to have the water go to the back of your mouth. You're gonna initiate the swallow, and then right after you'll return to a head neutral position. All right, okay. Go ahead and take a sip. And to position it, initiate the swallow, and then, all right, and that's it.
Hi, my name is Andrea. I'm going to be talking about the supraglottic swallow. It is designed to close the vocal folds by voluntarily holding one's breath before and during swallow in order to protect the airway and reduce the chance of aspiration during a swallow. So while continuing to hold your breath, the therapist will instruct the patient to swallow, followed immediately by a volitional cough. The purpose of the cough after swallowing serves to clear any residual material in the larynx or in the airway. So to demonstrate, Raven, I would like you to please sit upright. Good. Take a deep breath in, hold it, swallow, and then cough and breathe out. Good. So you will repeat this exercise as directed by your therapist.
Hi, I'm Allie, and I'm going to be going over the cough clear compensating strategy. So we can use a cough as either a reflex or a voluntary strategy, and it's used to clear the airway from obstructions. And we do this because failure to clear the airway can result in an increased risk of either lung infection or pneumonia. And it's used to identify those at risk of dysphagia. And also the presence or absence of the cough can help the clinician determine the patient's swallowing safety. So Andrea, if you can go ahead and cough for me. Good job. So that right there, that's a voluntary cough because that was intentional. Now, if someone was swallowing and they automatically coughed, that's a reflexive cough that's triggered by your airway sensors. So we can use those actually within assessments. And we just talked about the supraglottal swallow. And a way that we incorporate the cough into that sequence is you can start with a cough, then you take a sip, and then you cough again. And this initial cough ensures that there's no obstructions. And then you go ahead and swallow the bolus, and then you do a final cough to clear the airway. So just a brief preview of that. Andrea, if you can cough, do an initial cough. Okay, now go ahead and swallow. And then cough again. Okay, so that was an example of the cough clear method.
Hi, everyone. My name is Raven. I am going to be talking about the chin tuck, which is a compensatory postural strategy that's applied during the pharyngeal phase of the swallow. It's used to clear the pharyngeal residue and helps with protecting the airway as the bolus travels through the pharynx. So, Aubrey, do you have water nearby? Okay. So I'll go through how to do it. So your SLP may suggest that you do this when there's a delay in triggering the swallow or the posterior movement of the tongue is reduced. So we'll just pretend that's happening with you. So just before you swallow, you're going to drop your chin to your chest so that you're looking downward. And then you're going to stay like that for just a moment, take a sip and swallow, and then lift the head back up. So you can take a sip of your water now, and then look down, swallow, and then look up. So this is a strategy that creates more space in the back of the throat and also prolongs the time of the swallow so that it becomes a little easier. And you can also do this with a resistance ball, and that helps to strengthen the suprahyoid muscle. But like with every compensatory strategy, you're not actually changing the anatomy, you're just compensating to make it easier.
Hi, my name is Aubrey, and I'm doing the Masco maneuver, and this is a rehabilitative strategy. And the purpose of this is to increase the anterior movement of the posterior pharyngeal wall. This is an effective way for patients who have reduced tongue base of tongue movement. So in order to do this, Raven, we'll have you stick out your tongue and then gently bite down on it. And you're just going to do a dry swallow. So you're not going to need water or anything. So you'll do that. And then you do it 10 times. Yep.
So all of these strategies are dependent on the individual and where their strengths and weaknesses lie with their swallowing. And your SLP will select techniques to treat impaired physiology and not necessarily base the techniques on a sign or a symptom. And it's important to note that these strategies won't work for everyone. So please consult with your SLP for individualized treatment.